Hello everyone, this is Dr. J and welcome back to the channel. This is a 3-case compilation today, 3 different cases with 3 distinct different problems. And so we'll begin here with case number 1, before it's a problem. What do we mean by that? So a lot of times we can become involved with a patient's ear before it becomes a serious problem. So looking into the ear canal, we have some fairly deeply impacted pieces of cerumen. They're very dry. They're just kind of loosely attached to the ear canal wall and are coming out fairly easily. We're using the right angle hook to just get behind it, and the eardrums, you can see, is not too far behind this plug. As we tease them forward, lay them up so that then the suction can remove them very easily. But if left alone or undiscovered and untreated, then these can continue to pile up and then create problems such as canal cholesteatoma, keratosis obturans, and the most mild problem obviously would be hearing loss or infection. But this one cleared fairly easily. 3 decently sized chunks came out. The eardrum's nice and healthy there. And fortunately, we were able to intervene with that patient before it became a problem. Here's case number 2. This patient, both ears were almost exactly identical in how they presented to our office. You can see we're looking at the right ear. The cerumen almost has a glossy look to it, and then as we go in with the suction, it is just on the dry side and is kind of densely attached to the surrounding skin of the ear canal. How deep does this go? You can kind of see there's a pinhole there, and you can see through it, and you could see the tympanic membrane, so you know it wasn't completely obstructed, but how deep does it go? We don't know. So I go in again with the right angle, gently free it up from the surrounding tissue around the ear canal, and then just kind of hook it and pull it out. So not a huge plug, but a very dry plug. As we go back in the ear canal, we can see the skin is very loose, flaky, and dry. This will be very easy to treat. Put this patient on some eardrop regimens, and by the time you would see them back, this problem should have completely resolved, meaning the dry skin portion. And because that problem is resolved, they're not going to accumulate at the outer portion of the ear canal again. At least ideally, they shouldn't. Again, that could be complicated by hearing aids or hearing protection, ear foamies, earbuds, and such. But in this scenario, I'm pretty sure that some topical drops regimen will cure the problem. Here we go to the left ear, and as we go just inside the ear canal with the speculum, you can see it's almost exactly the same. A little more occlusive here at the entrance to the ear canal, right at the hair-bearing portion of the ear canal. This is where things tend to bottleneck, and I know I've talked about bottlenecks in the past videos, but this is kind of a prime example of where things can tend to pile up. You have a narrow opening, you have super dry skin, which is going to result in super dry wax, and it can't come out. Now, this isn't a very hairy ear canal. If it was, it would be a much bigger problem. And these pieces come out fairly quickly. There's another big chunk for this ear canal. It's one of the bigger chunks. And then one last piece here, and then you can see how it's attached loosely to some flaky skin. And you can see how on the back side of the ear canal wall going down to the floor of the ear canal, we just want to lift up that loose skin and get it out. Now, I'm being very gentle. You can't just lift up and pull aggressively here. Sometimes skin peels can go very easily, and the patient really doesn't feel much. And sometimes it can actually be tender and painful to the patient. So you don't want to be overly aggressive when you start pulling on this, because it can still be densely attached. And sometimes, especially in elderly patients, it could create some bruising of the ear canal. A little hair there, got that out, and that ear canal is clear. Again, eardrop regimen, and then they should be good. So let's move on to the last patient. This is a large single wax plug. This is case number 3. And as we get in the ear canal, yes, it's hairy, and that's part of the problem. But my speculum, as we enter here, we can see that the canal is not circular. It is very narrow. My speculum tip is about 6 millimeters. And you can see here that the width of the ear canal is probably half that. We're talking 3, maybe 4 millimeters in width. So it is really tight, and probably most likely reason why this cerumen impaction is happening as bad as it was. We're in here testing the wax plug just to see the consistency and see how easily it's moving around, and it is pretty sticky. And my next move is obviously some lubrication to help get this freed up. Here comes some Colace. Nice purple tint to the Colace when it's in the ear canal. Moving back to the suction, we'll try and manipulate the plug now so that Colace can work its way around, circumferentially around all the edges to try and free that up so it'll move out easily. And it does move a little bit easier, but still we're going to have to pull a plug through that really narrow opening. Again, it's another bottleneck scenario. The entrance of the ear canal a lot of times is narrower than the actual caliber of the internal portions of the ear canal. As we start to move here, I'm going to move up towards the upper or superior part of the ear canal and try and roll that down. And then as we shimmy that back and forth, eventually applying a little bit of suction power, we're able to get it just into the opening so that then it's able to maneuver out more easily. From the outside view now, the plug is right on the doorstep here, right on the threshold of the ear canal. And again, it's trying to squeeze its way past that most narrow portion of the ear canal. Now, I'm going to sign off here, and I want you to listen to this patient's reaction to seeing his own earplug. I'll pull it out and I'll hold it out in front of his face so he can actually see it, and we'll listen to that here in just a moment. And here he goes.
Open your eyes.
My gosh, whose is that?
Not mine.
That's a dead fly. Oh my gosh.
Here, go ahead, lay back down. I want to make sure the rest of it's good.
I'm amazed the audiologist didn't see that. That is huge.
All right, everybody. Thanks for watching. Thanks for sticking it out to the end, and we'll see you on the next video.